Hi everybody, my name is Julia and today I'm going to be talking about groups that are othered in healthcare. The group that I'm going to be focusing on today is alcoholics. One bias that I can identify that I hold about this group, open honesty, a bias that I have is that the individuals that I've seen that come in with problems related to alcohol is that it's their own fault. I know that this is a judgmental bias and one that is not great to have, but I know that other people think this as well. I've heard other doctors talk about it and nurses, which is unfortunate and a bias I wish that I and others didn't have. Other biases that I have witnessed in healthcare settings and in the community about this group of people, a lot of, in my experience, I have heard providers violate HIPAA and talk about overshare about the patient. I've seen people go back into these individuals' charts and like years and see how many times they've been hospitalized related to alcohol. Other biases I've heard is that they're just unsuccessful, worthless people. I've heard people just assume that they're homeless. So sad biases, but things that I have definitely heard. So when I'm considering the cognitive process that was in the cross-carry article, one thing that I thought that these biases affected othering when thinking about the individuals that come in with alcohol problems, their population was the dual process theory of decision making. The article talked about the type 1 process working well most of the time. However, this does open the door for biases. So again, the example of violating HIPAA and looking through charts and just opening the door for biases for these individuals. When moving on to the Madden article, when I was reading this article, one part that stood out to me was the part that was talking about the health and the sociocultural resources of complex patients that may be not as wealthy or as privileged as people that have more money, that these patients aren't aligned with expectations in medical settings, and they don't have the same opportunities that the healthier and the wealthier populations have. This kind of stood out to me in the Madden article because I thought about individuals that present with alcohol problems right away. I think that most of the time I've seen that they're judged right off the bat. And kind of moving into the second questions, the effects on these individuals, I think this ultimately leads to misdiagnosis. There was an example, and I believe there was an example in the Course Carry article too. It was talking about an individual who came in for constipation, and it led to misdiagnosis. So I think this is definitely something, it's not something that I have seen personally, but something that I can definitely see happening. A individual might come in drunk and they could treat the patient for his withdrawal, but say maybe they miss that the patient is falling into liver failure, say. This is something that I can definitely see happening, and it worries me about the effects on this individual group and ultimately the group as a whole, because this could be a problem for several alcoholics who present to the hospital or to their emergency department. When I think about this problem with healthcare providers, I just think about, I really think about ethics and how this could be an ethical problem and even a licensure problem if there is a really big misdiagnosis and something that a provider misses. So that's kind of what I think about when thinking about healthcare providers misdiagnosing potential alcohol problems. If I could change one thing to better meet the needs of this population, I would change the amount of training that people get. I think that the people that do hold the bias about people that do hold biases about individuals who are presenting with alcohol problems maybe should undergo some holistic training, some empathy training, focusing on treating the patient as a whole and not just a diagnosis would benefit these individuals. Thanks for watching.